Hi, everyone. Today I want to talk about the pros and cons of using military or violent language to talk about illness. For every positive aspect that these kind of warlike metaphors can give us, there's also a potential downside, and I've seen both of them at play in my own life. So we'll go down the list here. First of all, it does promote courage and positivity, and I'll speak to that directly. I was very squeamish when I was diagnosed with cancer. I had serious difficulty sitting through, for instance, the orientation session where they explained what chemotherapy would be like. I had to leave the room. My wife had to take notes for me as I sat out in the hall and fought back a clammy fainting spell. However, donning the mask of the cancer warrior it helped me to sort of steel myself and to say, this is a test of courage, and you need to pass this test or you won't survive. Um, However, there is a downside to that sort of cancer warrior mentality, which is the repression of negative emotions. Cancer warriors are pretty much expected to think positive all the time. Soldiers don't have time to cry. They don't have time to show weakness or think negative thoughts. They simply do what they're told. And there's lots of studies that show that repression of negative feelings is the biggest psychological obstacle to healing from whatever your experience is, if you're lucky enough to survive it. The second positive aspect of using those warlike metaphors is that it does promote solidarity and camaraderie. If we're all fighting a war against cancer, we're all in it together. There's sort of a collective sense of belonging to something bigger than yourself that you can draw strength from and that other people can use to support you. However, it does alienate some people who just are not at all militaristic. I was in the Canadian military briefly for one summer. I happen to think that soldiers are generally very honorable people who respect their country and do their duty. Some people don't feel that way at all, and they react in revulsion to military language. This is also, potentially kind of a cognitive dissonance situation where survivors of a particular disease see themselves portrayed or celebrated as fighters and so forth, when that's not a label they would ever apply to themselves. Anyway, another positive side of those warlike metaphors is it does promote clarity of understanding. I had a disease called graft versus host disease that essentially attacked the rest of my body. There's no other way to describe what happened there. Attack is, implies the violence that was being done in my body. And that attack, again, plays into the battle warlike metaphors, which in some cases are, in fact, irreplaceable. However, the downside of all that is that sometimes it can promote an oversimplification of the illness. And this also shows up in treatments for cancer. Sometimes cancers are not treated best by aggressive methods like chemotherapy or radiation. Sometimes, a less damaging, less aggressive approach is actually better for the patient in the long run. But anyway, yeah, so if we think of everything as a battle, sometimes we just think we have to kill the cancer, kill the cancer, kill the cancer, when maybe it's not that simple anyway. Another positive aspect of these metaphors is that they do promote hope, right? If it's a war, if it's a battle, there's a chance of ultimate victory, of somehow winning, even against terrible odds. We've all heard the story of, David and Goliath. However, this can also have the downside of promoting overtreatment. In other words, when there is no chance of survival any longer. But people who are told to keep fighting or who feel they have to, keep their warrior mindset in place, they agree to treatments that don't really prolong their life very much and needlessly extend their suffering when in fact going into a palliative care situation would be much better and would assure them a higher quality of life for the time that remains to them. Back to the positive side, it can promote a certain euphoria at achieving temporary victory, right? Just getting through the day feels like a victory to some people, and indeed I was one of those people myself. However, it can also play into survivor guilt and shame, right? In battle, there's always the chance, my buddy next to me died, he took a bullet, and maybe that bullet was meant for me. Why did he die instead of me, and so forth? I have absolutely caught myself thinking in those ways about roommates that I had when I was being treated for cancer, who died, and I often wondered why did I survive and why did they die? And anyway, but that battle mentality of, my buddy took a bullet that was intended for me, that has absolutely no place in the context of illness. No one dies of someone else's illness. And yet it is a factor. People do talk a lot about it, and I've felt it myself. A kind of survivor guilt where it's a zero-sum game, right? Either someone dies or I die, and I happen to survive. So ergo, I must be guilty of their death. That is something deeply buried in our unconscious that has no rational basis whatsoever. And I do think that is promoted by the warlike language in the context of illness. Okay, back to the positive side. That military language does honor survivors as heroes and winners. Okay, but right away you see the downside is it stigmatizes people who die of cancer or other illnesses as losers. And the phrase that is the most sort of awful in this regard is when someone dies of cancer, people often say he or she lost their battle. Now, that is such a cliche that a lot of people don't even notice it anymore, but I notice it and I object to it strongly. And I've read plenty of accounts of people saying, if I do die of this disease, don't say that I lost my battle. Even if I fought courageously, even if I was a warrior or a fighter, whatever, just don't use that loser language. It has no place in the way I view my life. Okay, back to the positive side of that military language. It does promote research and innovation in treatment. There was a famous, National Cancer Act in the early 70s that was informally known as the War on Cancer, right? We're going to devote a lot of public money and time to trying to make inroads in our options for treating cancer. And that does help. It was sort of a collective commitment, right, on the part of the US federal government to pushing a lot of money into this process. And sometimes it does pay off. It often does pay off. However, again, this can promote over treatment, right? In the same ways that we've talked about before. Even if hope is gone, right? If we just throw new weird ideas at people because we have to keep them fighting somehow, that can entail needless suffering. Okay, on the positive side, this warrior mentality does promote something called fighting spirit, which was a phrase that has been used a lot, like in the 70s and 80s, to basically, indicate a positive mindset, right? And that positive mindset was very important when cancer was seen as essentially a death sentence, as it was when I was young. If someone had cancer, well, that was it. There was no way they were going to make it. So the antidote to that was something called fighting spirit, but that covered just general positivity, which can indeed be helpful. Thinking positive cannot cure cancer, I don't believe, but it can help, to build resilience and to help also recover when the illness is less severe. However, this fighting spirit can also produce some misdirected anger. Anger against your doctors, anger against people, just in your life, because you're fighting, and you can't stop fighting for long enough to recognize when people are trying to help you. I myself had plenty of misdirected anger against my caregiver group. Even my parents, sometimes I was frustrated with them. And I think that was a byproduct of my sort of warrior mentality. It's like, here I am fighting for my life, and they didn't bring the right socks to my hospital room. And I think a lot of people can identify with that. But there are reasons for genuine frustration with our medical establishment sometimes. But anger in that context is rarely helpful. Back to the pros. It is, I believe, the fighting mentality is helpful for acute illness. If you are truly, in danger of dying, as I have been twice from blood cancer and once from acute graft versus host disease, being in that fight or flight mentality is appropriate. Your existential, predicament is so dire that you might as well think of yourself as a soldier fighting every day for survival. However, once you're out of that acute phase, that mentality turns into a negative because the fight or flight reflexes in our body are in a separate part of us than our parasympathetic nervous system, which governs processes of healing. That also, those same processes govern our eating, and our sexual functioning, and our emotions, laughing and crying. Those are self-healing activities that when we're in the fight or flight mode, we cannot access those things. But that's where healing lies in the parasympathetic nervous system. So once again, that warlike mentality is unhelpful when your illness is just a chronic one that you can't really fight. Another positive aspect of the warrior mentality is for raising awareness and raising funds. And I'm sure you can think of all kinds of public campaigns, stand up to cancer, for instance. Well, the implied metaphor there is that cancer is a bully, right? And if you just stand up to cancer and show like bravery and defiance, cancer will like back off somehow, as a bully might do. Well, on the on the downside of all of that, that can really alienate survivors who know that it takes a lot more than just defiance and courage to get through what they've gotten through. And often strategies used to fundraise or raise awareness about a disease really don't ring true to the people who've actually had to have that disease. All right. Another positive aspect to this, warrior mentality is that it does acknowledge the intensity of the treatments. It does justice in a way to the visceral, violent nature of what often goes on in our bodies when our bodies are, as I say, attacked by a disease that hurts us. And the treatments also can hurt us. Chemotherapy and radiation, they have negative effects on a lot of our organism, even if they are employed in a ultimately healthy cause of continuing our lifespan. Now, the downside, okay, of that acknowledgement of the intensity of our treatments is that it does promote a sort of division between our mind and our body, right? Because the mind knows that the treatment is necessary, and yet the body is suffering because of the treatment. And I found myself I've always thought of myself kind of as a mind up here and a body down here, and the two don't really communicate with each other. And that's why I felt like I kind of needed that warrior mentality so that my mind could tell my body that it needed to suffer and needed to be brave and needed to submit to all that stuff. But at a certain point, we have to realize that our minds and our bodies are connected. And that is, again, part of the healing process. But again, you can't heal, if you don't survive. Okay, another positive aspect is again that sort of celebration of the daily victories over death. Just getting through the damn day is a triumph if you're living in a war zone, so to speak. And the war zone in my case was my room in the isolation ward when I had acute graft versus host disease. Just surviving was already an amazing achievement. However, the downside of all that is it does delay and even deny grief and mourning for the things that have been lost in the course of that really difficult treatment. I believe, I'm a very different person than I was before cancer. But if I remained in that state of the warrior mentality, I would never get to grieve for the loss of the person I was. And again, it goes back to that suppression of emotions that the warrior mentality tends to promote. Another positive aspect of the warrior mentality is it acknowledges the trauma of illness. Okay. In other words, yes, we do experience something analogous to like PTSD that soldiers experience when they go into a war zone and have horrible things happen to them, their buddies, or they witness awful atrocities or even commit them. However, the downside of all that is if we stay in that mentality, we do risk prolonging and even aggravating the trauma. Again, if you think of yourself as a soldier and carry that burden of the warrior mentality, the survivor guilt, etc., the trauma that you have experienced tends to linger. And if you can sort of put away that mentality, you're going to be better able to deal, it seems to me, with the trauma. That was my experience anyway. And the final positive aspect of this cancer warrior fighting mentality is that for some people, it engages their faith or their spiritual energy in the cause of survival. If they believe that it's almost like their duty, as someone who believes in a certain religion, let's say, or in a certain set of spiritual beliefs, it's their duty to do their utmost to survive. However, this does have a downside, as all of these positive things do. It risks also stigmatizing illness as something that is evil or sinful. In other words, some aspects of spirituality, not every form of spiritual belief, but some basically believe that the wages of sin is death. To quote a famous Christian saying, that our illness is somehow a reflection of something that we've done wrong, that something, some deep sinful aspect of ourselves has been exposed and punished. And sometimes people also expect that, well, God will not actually, permit us to endure this evil forever. So they wait and wait for God to revive them. And that's not going to happen in a realistic medical situation. All right, so that's the list that I have compiled of pros and cons of this fighting military language in the context of medical discourse. I've been reading about this for about a year now, and I think this list is pretty exhaustive. Might even be a little redundant. Anyway, I'm curious to see if anyone in the comments to this video will offer any more things to put on either side of the ledger. Although again, I do believe that this type of language has a positive aspect, but every positive aspect of it can also have a negative aspect if it is taken too long, taken too far, or kept for too long. Thanks for listening to this rather lengthy video.